Hello, and welcome to Rutgers University. Rutgers Student Health understands there is a lot of important information that you need to know before attending Rutgers. Rutgers University, the Division of Student Affairs, and Rutgers Student Health is committed to providing all of our students with healthy and safe programs and support services. While we do not know what the future brings and where our students will be located, following state and federal guidelines, continual assessment and program adjustments will guide us in meeting your needs. We believe that health and wellness information is an essential resource for students and their families. Everything that is covered today can be found at health.rutgers.edu. Today we're going to be talking about medical services, counseling, alcohol and other drug assistance programs, and psychiatric services, otherwise known as CAPS, insurance, immunizations, student health fees, and health outreach, promotion, and education. Please know that all services will be provided in a combination of in-person and remote as appropriate. Rutgers Student Health is a fully accredited primary health care facility. All of our services are provided by medical doctors, nurse practitioners, registered nurses, and medical technicians at 3 locations: the Hurtado Health Center on the College Avenue campus, the Bush Livingston Health Center on the Livingston campus, and the Cook Douglas Health Center on the Cook campus. All services are by appointment only, and students can make appointments by calling 848-932-7402, or they can make appointments at health.rutgers.edu. Our health centers are for more than when a student feels sick. In addition to routine and primary care, Rutgers Student Health offers preventative services, medical counseling, and patient education. Our services include physicals and wellness visits, management of acute problems such as fevers, respiratory illness, stomach pains, sprains and strains, and skin rashes, management of chronic illnesses and concerns such as asthma or high blood pressure, travel medicine, gender-specific care, sexual and reproductive health, including contraceptive management and sexually transmitted infections and HIV testing, immunizations and administration of allergy shots, and COVID testing. Students should bring their insurance card with them each visit, either a hard copy, a photocopy of the front and back of the insurance card, or a digital image. If your student requires a specialist, they will be referred to one that accepts your insurance. We don't want anyone to have a surprise bill. Student health centers are open Monday through Friday, 8:30 to 5:30 p.m., with later hours Monday through Thursday at the Hurtado Health Center. Student health is available year-round at the Hurtado Health Center. Rutgers Student Health understands that students may struggle with their emotional wellness and mental health during their time at Rutgers. CAPS offers mental health support for Rutgers and Brunswick students. CAPS works with students to develop an individualized action plan based on each student's unique needs and the range of resources available at CAPS within the university and the surrounding community. The CAPS staff includes psychiatrists, psychologists, clinical social workers, and substance abuse counselors. One-on-one and group counseling is offered by PhD-level psychologists and social workers. The Alcohol and Other Drug Assistance Program offers counseling and support to students who are struggling with their own use, abuse, and addiction with alcohol or other drugs, or who are negatively impacted by someone else's use, abuse, and addiction. ADAP offers one-on-one and group services. In addition, ADAP offers recovery housing for students in recovery who would like to have the traditional on-campus residential experience, but would like to live in an environment that supports their recovery and sobriety. Rutgers has the oldest recovery housing program in the country. Psychiatric Services is staffed by psychiatrists to assist students who are using medication to help manage a mental health condition, allowing students to access psychiatric care on campus and make sure their medication is working appropriately. Rutgers community-based counselors are social workers embedded throughout the campus, providing Let's Talk drop-in hours and working with faculty and staff in various communities throughout Rutgers to build support and awareness of mental health issues. Our Next Step program is a campus-based treatment program tailored to students who need enhanced care. Students attend a combination of psychoeducational groups, psychotherapy groups, and they also have individual therapy each week. They also have a case manager. There are 2 counseling center locations. The primary location is on the College Avenue campus, and a satellite location is on the Cook Douglas campus. All visits are by appointment, and students in crisis will be seen that same day by the on-call clinician. All students are required to have insurance, either through a parent, their own, or through a spouse. Regardless of whose insurance covers a student, all students can utilize Rutgers Student Health Services. All students should have their health insurance card, either a hard copy, a photocopy, front and back, or a digital image. Each semester, students are required to show proof of insurance. If they do not have insurance, then they must purchase insurance through the university-sponsored plan. The plan covers students both on and off campus and provides coverage from September 1st through August 31st of each year. Your student is going to receive an email directly from University Health Plans to either enroll in or waive the university-sponsored plan. Rutgers Student Health third-party bills the insurance for our services rendered. Balances are billed through student accounting and billing. Rutgers University follows state requirements for immunizations, and this includes measles, mumps, rubella, hepatitis B, meningitis ACYW. Meningitis ACYW is the standard immunization for everyone less than 19 years of age and anyone entering a college or university for the first time, and individuals with high-risk conditions. Meningitis B is required only for those with high-risk conditions. All immunization records, must be submitted through the immunization portal that you see here on the screen, https://nbstudenthealthportal.rutgers.edu. The deadline for submitting immunizations is June 15, 2021. Please note that no hard copy, faxed, or email immunization records will be accepted. If you have any questions about immunizations, please send an email to vaccine@echo.rutgers.edu. Health Outreach Promotion and Education, also known as HOPE, provides education and outreach in the key areas that impact college students. This includes mental health and suicide prevention, alcohol and other drug education, sexual and reproductive health, nutrition, and general health and well-being. HOPE offers peer education in all of the above areas and collaborates closely with partners across the university to support student health and wellness. In addition, HOPE offers opportunities to students through internships and academic courses. Every student pays a student health fee as part of the standard student fees. These fees support all student health and wellness initiatives on campus, including medical, CAPS, health outreach, promotion, and education, and public health initiatives such as vaccine clinics, dissemination of health and wellness information, and all educational outreach. Everything mentioned today can be found on our website at health.rutgers.edu. Please follow RU Student Health on Instagram, Facebook, and Twitter for up-to-date information about health and wellness and the health-related events on campus. But most importantly, welcome to Rutgers.